talking disc injuries again. This one's going to be about spontaneous regressions. Something I discuss a lot with patients when we do a lot of imaging post-accident, even in kind of more just regular populations of people that have had a disc injury or an injury to a disc becomes apparent upon imaging for one reason or another. It's a couple little ways to get started. So define some terms. So when we have injuries to discs that come in the spine, they come in like four varieties, basically. A bulge, where the center parts of the disc, the more gelatinous parts of the disc, have created a bulging of the outer layers of the disc, but nothing has gone through the layers. A protrusion is those inner gelatinous substances are starting to push through some of the layers of the outer rings of the disc, but they haven't fully breached the outer rings. And extrusion is that inner core of the disc, that gelatinous inner core of the disc has gone through all those cartilaginous, all those annular rings, annular fibers, and has breached the outside layers and is out into the spinal canal, but is still connected to itself, the middle of the disc. And then sequestrations are when that inside of the disc gelatinous portion has pushed there's been injured all the way through the disc and has also become separated from the other parts of the disc into like a fragment that can start free floating around. So just keep those things in mind as we talk about this. So these are things that I think are very important for people to understand, and particularly when I'm working with patients in clinic. The important thing is just to look at the systemic review. This is from a bit ago, but it still has really good information about the rates of spontaneous regression, probabilities of spontaneous regressions in herniated discs, different varieties. So the important things to remember are the more the disc is injured, the more of the stuff that has come out of the middle and pushed through the annular fibers and outside of the rings, the more likely there is to be spontaneous regression. Perhaps this is not always true. Perhaps when we get into like extruded and sequestrated discs, there may be higher levels of symptoms. But that's not always true as well. But those types of injuries that they may seem or appear more, quote, severe on imaging, they have the highest likelihoods of having spontaneous regressions. The body has mechanisms set up to deal with foreign objects where they're not supposed to be. So if we go from one level to the next, bulge where there's just the disc has got some pushing out of the outside fibers, but nothing has left the disc, we're only going to see about a 13% spontaneous regression probability in those, because there's, to put it simply, there's nothing for the body to fix because nothing has left the inside of the disc. The protruding discs, where it starts to create a little bit more compromise of the system because there's more of those insides of the disc pushing towards the rings, is like a 41% probability of spontaneous regression. But when we get into extruded discs, where materials from the inside are now breaching the outer rings of the discs, extruded discs, 70% chance of spontaneous regression, and sequestrated discs, so not only has the inside gone through all the layers, but part of it has fallen off. Those are 96% spontaneous regression, with 43% of those sequestered discs undergoing complete resolution and healing. So there's going to be a fraction of those that still have not complete full resolution, and there's a lot of reasons for that. The body doesn't do the best job of patching these things up compared to some other parts of the body. There's just not as many raw materials and blood supply and things like that to the area. So the process isn't quite as tight as saying like getting a cut on your skin and it knitting back together. But just those probabilities are important for people to realize that if we look at the study, I was looking at healing times of 3 months to up to a year. So if people have a disc injury that looks really severe on imaging, even with conservative management and time, within a year, that there's a 96% chance that disc injury is going to spontaneously regress. And on top of that, it's a very almost a 50% chance that it's completely resolves. The last important piece of this to remember is symptoms don't correlate with the level of injury that you're perceiving on the image. People may have a bulged disc that's giving someone way more severe symptoms than the person that's got like a full-on sequestration or extrusion where materials have pushed out into the spinal canal or towards nerve roots. So you don't always know, what level of injury to the disc you're going to see on imaging that's going to correlate to how the patient's feeling. And even though it may take a year for the body to completely heal the disc, the likelihood of that person having huge symptom reduction or even symptom free within 3 months is really high. So what ends up happening many times is, depending on who a person sees when they have a disc injury, who talks to them first, there may be this over medicalization of the problem, and more invasive procedures than are necessary may be recommended or pushed in the beginning, even though it may not be in the best interest of the patient, may not be in the best interest of the long-term healing process. There will be some times where more invasive actions may need to be taken, but for the most part, if people are just dealing with symptoms of pain, staying conservative, letting time take its course, letting those probabilities of regression of the injury play out and the less you do with a person, the less you do to them, the better in a lot of instances. And what I mean less invasive things you do, the better. So just keep all those things in mind and understand, if you are somebody who has a disc injury, has been told you have a disc injury, they get better. The body will work towards resolution of the problem. The more stuff that has left the inside of the disc, the more the body is inclined to heal it. So just understand, while you may have some symptoms, discomfort, restrictions in the beginning, more than likely, no matter what's happened, your body will go into some level of spontaneous regression, heal up, symptoms reduced. The biggest thing is don't panic. The biggest thing is don't get scared. The biggest thing is don't let it feel like a catastrophe to you. Just move forward, do what you can. The body will take care of the rest. With that said, check out the rest of my channel for more information. See you later.